Welcome to What Do You Understand, brought to you by Global Partners for Development. I'm your host, Ria Pullen, and together we'll explore the world of philanthropy and development, confronting global disparities and the impacts of our collective efforts. Joining me is my co-host, Daniel Casanova, the Executive Director of Global Partners for Development. So, are you ready to question what you understand? Let's dive right in. Today, we're joined by Ash Rogers, the co-CEO of Lwala Community Alliance. In our conversation, we'll uncover how Lwala's model goes beyond just healthcare delivery to foster a community that's educated, empowered, and resilient. We'll hear about their successes, the challenges they've overcome, and the powerful stories of the individuals whose lives they've touched.
My name is Ash Rogers, and I am the co-CEO of Lwala Community Alliance, and we partner with the government of Kenya to improve health systems and achieve holistic, better life outcomes for our communities.
Fantastic. How long has Lwala been around?
Lwala is now in almost our 17th year.
Oh,
wow. And was founded by two Kenyan brothers and their community, and really a response to the HIV epidemic and really a maternal and child mortality that was associated with that pandemic, and really a reaction to the injustice that they didn't have access to healthcare. And so they organized, they donated community land and resources, and they built themselves a hospital and said, we'll create the health system that should be reaching us. And from there, then the organizations build what we call our community-led health model that starts with community organized around health.
fantastic. Very cool. Are the brothers still involved?
They are, yeah.
That's great.
So our co-founders are on our board, Fred and Milton Ochieng, and they are both physicians. One is a gastroenterologist, and the other one does cardiology. And so, they're all smart fellows, and have been, just really important supporters of the organization and founders of the organization. And they actually kind of different for Lwala than some other organizations is that our founders never ran the organization. They got it up and running. They supported their community. They've supported fundraising and kind of early days of like getting it up and running, and then have always wanted it to have professional leadership that was separate from them. And
so is that you?
That's me.
You're the hired gun.
I'm one of the hired guns. Yeah.
What kind of led you to that journey to where you are now? What were you doing before Lwala? How long have you been with Lwala?
Yeah, so I started my career, I should say kind of before my career. In undergrad, I was really interested in the continent, and I had an opportunity to go to Uganda right after I had graduated, and did some work with different organizations at that time. Realized I would really love to contribute to what's happening, and met a lot of local leaders, and kind of felt the optimism of work that was happening in Uganda, which is where I was exposed to at that time. And I don't have any helpful skills, so I should go get some and be useful. And so I went to grad school, and did some internships and whatever, and then was part of a program called Global Health Corps, which was founded by Robert Bush's organization, and had the opportunity to go back to Uganda, work with a small organization. I don't know how helpful I was, but I certainly had the opportunity to try to be helpful.
And you learned, I'm sure, while you were there.
I learned a lot. I got a lot out of it. And at that time, there was a family foundation that was just getting kind of up and running called Siegel Family Foundation. And so I came on early with them and had this really cool experience of being involved with this family as they tried to lay out their vision for philanthropy, and which ultimately was really based on humility and them wanting to fund local leaders, wanting them to help local leaders get more access to capital, both their own, but also how can we crowd in other philanthropists to support the organizations that are just such a small percent of global financing for development. And so I worked with Siegel Family Foundation as their director of operations, and Lwala was in my grant portfolio.
Oh.
And so I got to know our founders, the organization. I visited several times over that period of time. And I also got to see a really wide range of community-led organizations, and kind of see the trajectories of growth or kind of lack thereof that was happening across that set. And I felt like there was an opportunity, like that Lwala had some unique attributes. One being my now co-CEO, Julius, who had been brought in about 6 months before I joined the organization, as well as having systems and structures, some good evaluation, some good research that was like aligning with this real community-led model. Yeah.
And they needed a sucker to fundraise for them.
They needed some. honestly, like what I can do is leverage money, and so I felt like, it had this real opportunity to just kind of repackage incredible work that was already happening, but get it in front of people with more money and be able to really see a faster growth trajectory. And
have you been successful at that?
We have. We've had a 14-fold increase in revenue since in that almost, I guess it's like a 7.5 year period. And there's more growth to come. And I think that a lot of that, of course, is our incredible team that's been able to really demonstrate impact on the ground. A lot of that's because of our administrative health partners in Kenya and really the Kenyan government's like increasing ambition and the real resources that they're putting behind universal health coverage, and that's made it easier to sell and to be able to say like let's come behind a movement that's winning,
Right.
And so when it started, did they start out as like a dispensary and then turn into like health clinic, and then are you like a class 4 health?
That's exactly right.
Yeah. Okay.
Yeah. I don't even know if we had the word dispensary at that time for what was happening.
It probably was. I mean, throughout the region, I think it's pretty standard. I mean,
it was standard in Kenya. Did we call ourselves a dispensary?
You were like,
no. We called ourselves. I think from the beginning, everyone's
you were like out of the trunk of a
right?
car.
Like everyone's a doctor.
Yeah.
I know. But no, like really humble beginnings. And in the beginning, like there's stories from Fred and Milton, them going to local government, to Ministry of Health officials and being like, can we have some like drugs, to run this thing? And then being like, oh, people as like, this is kind of a crazy idea, like you're still in school, come back when you've like done something. Like, hey, let's see what you can get going on your own. And so it's been an evolution of that partnership with government, and I think it's come alongside a real shift in the health sector in Kenya as well, like kind of what the ambition is.
Do you feel like, so you guys must be doing things with the government then on a policy level and stuff? Like, tell us about that and what that's like, or if you can.
No, this is like the health moment in Kenya. We've had now like successive presidents who've really put their voice behind universal health coverage. And Kenya has had, one of the most successful national health insurance schemes on the continent. In NHIF, it has challenges, but it's a real kind of foundation to build UHC upon. And Lwala has been working with a coalition of organizations in Kenya towards putting more resources into community health and community governance and professionalizing the community health workforce. And that has been an argument that we've been working on globally. Some of the WHO, USAID, Africa CDC, all of these actors are really important to that norm setting and like what what countries are able to make possible. And so we have a global coalition that we're part of called the Community Health Impact Coalition. We've been fighting that fight together. And then also a national coalition that's been doing that same work. And that has come together in the last couple of years where the conversation, while really seeing a sea change, which was before literally people coming to these conferences around UNGA and saying like, oh, isn't it fantastic the return on investment you get from community health workers because they're volunteers, right? And like bragging about their exploitation of unpaid labor.
That's gross.
And that's not the conversation anymore.
Well,
And
things
so
need to be low-fi and low barrier, and we need to like have
like the
Because you want your nurses to be volunteers when you go to the hospital.
let's find some of the poorest, most disenfranchised people
And
in
give
the
them a bike.
world, and then get them to work 40 hours a week to solve their own health challenges. Like this is
And not pay them.
And silly arguments about how like, well, if you paid them, then where would their intrinsic motivation go? As if none of us are paid.
Yeah.
When
Well, they're getting
we're-
healthcare.
Yeah.
They're bringing healthcare to the community.
Oh my goodness.
So that argument, luckily, has really shifted, and I think that there's a lot more global acceptance of the idea that community health workers ought to be paid. That is also the change that's happened in Kenya, with the Kenyan government really seeing an opportunity to achieve universal health coverage through making further investments in community health. And the president with the Council of Governors have announced that they want to start doing that, and that they want a scheme to have the national government match county governments for the payment of community health workers. And so that's on the table, and kind of a big opportunity. And Lwala's been working on that with our partners for many years. Hopefully we can get some legislation that would kind of codify that. And then, there's all the other pieces where like now folks need to be supervised, and you need good digital tools and proper training. So there's the other building blocks to put on it. But I think the Kenyan government's in a really exciting moment where they're setting a big vision, and they're kind of bringing development partners along with them and saying like, this is going to be Kenya's strategy, and you're welcome to support it. And so we're excited to be in it with them.
That's great.
That's super cool. I can ask you loaded questions now.
Sure.
What's your favorite Bruce Springsteen song?
Oh my gosh.
No,
So
they
I-
just use funnier for them songs.
I think it's
I'm like, I wanted her not to have one.
my favorite Bruce Springsteen song is Dancing in the Dark.
Okay.
Like for sure. I feel like very seen.
You feel very seen. Is that what you do? You like to dance in the dark?
Yeah. No, but Bruce has been a supporter. Bruce and Patty have been supporters of Lwala really since our founding.
Wow.
And had become early friends of Fred and Milton. They had a mutual friend who had worked for the family, and had introduced them right when they were trying to get the clinic started, right when they were mourning and dealing with the deaths of their parents, and then also trying to do this crazy ambitious thing of starting a hospital and fulfilling their father's vision and partnering with their community. And so the Springsteens have been supporters, and had been quiet supporters of the work for really since our founding. And then Lwala is building an endowment for the hospital.
Oh.
And so the idea is that like the private hospitals in the US that you and I go to, like those are endowed.
Mm-hmm.
The universities that folks are attending, like those are endowed.
Yep.
And yet we've gotten wild reactions to the idea of endowing a Kenyan-owned hospital.
Well, yeah. It's contrary to like motives of like, spending down things and doing that. But it's, I think it's different if you're talking about something that's on the continent and in the space. It's a different
Well, and the
conversation.
community wants it to exist in perpetuity.
Yeah.
And the continent is covered with, mission hospitals that have been planted and filled. And so it seems radical for some people, but not for the boss. He was pumped, like Bruce and Patty are in it, and they're like, we want to do something public for you all. to get more support of it. And it's we're backed by folks like Bridgespan, who wrote this incredible article about Black-led endowments and saying that being for philanthropists to put money into an endowment like this is it's the ultimate form of trust-based philanthropy.
Yes.
And so we're pumped with it, and I feel like there's no better face of the campaign than Mr. Springsteen.
Yeah.
So we're
Yeah. Well,
That's
good thing you had a
awesome.
song to pick.
Yeah.
Yeah.
that would have been tough if I was like,
Oh, shoot. Let me look on.
we'll edit it. You can on your phone for a second. Listen.
perfect.
Yeah. Okay. No, my next one would be I hear you touting the line. You're like community led, not community driven. Do you? What do you think about that? In terms of do you feel like there was a moment where you would have said things were community driven historically, and then now you say community led now just because it's there's that movement to make change, or would you have always said community led?
No, I think I would have always said that these are semantics and and I'm not sure I know the difference.
And I'm not trying to
between
get you on
between
anything.
the
I'm
two.
curious, sincerely.
No, I think that I feel like we feel part of the community-driven development movement.
Yeah.
And community-led health has been the model and the vernacular that's resonated in Kenya, and that's resonated with our communities and with Ministry of Health.
Yeah.
But I think essentially when we think about community-driven development in the wider space, there's some tying ourselves in knots of what actually we mean. And I think that there's also a conversation that's important around decolonization. And we also feel part of that movement, and they're not exactly the same. And so I think that there's different levels of that work that Lwala is trying to do. And one level is the program model itself.
Yeah.
And at the program model, our work starts with organizing communities so they can participate in the health system, that they can launch their own health initiatives at the local level, but also that they can participate in local level budgeting, and strategy processes, in county level legislation. Devolution in Kenya means that there's real opportunity for democratic participation
And transparency.
and transparency in the health system. And that's something that is so new. This is a constitution that started in 2010. And so there's a real opportunity to bolster that. And so programmatically, that's where our focus is. And then in the organization itself, we're trying to practice both decolonization and elevate our community leaders. And so we have this co-leadership model where we have two CEOs, and the other CEO is Kenyan and from the region that our community serves. And all of our US-based staff, including myself, are focused on leveraging money. And then every other position is in Kenya and held by a Kenyan.
What's something that you feel like you understand particularly well that drives you to do what you do, or that's part of a message that people need to know because it's important in this time so that we can head in the right direction?
I think one thing that I know intimately is the experience of pregnancy and the experience of giving birth. And in particular, my first child, I was pregnant with my first child while I was interviewing for this position with Lwala. And I got the job offer while I was in labor.
What?
And I was on my way to Aga Khan Hospital in Nairobi, and I took the call because I'm a crazy person, and but also because having your first child is filled with lots of uncertainty, and I really wanted to know this thing before I was gonna provide this miracle of creating life. So anyhow, I took the job offer, and then, or I kind of heard the job offer. I told them I'd get back to them
After the next contraction.
in 24 to 48 hours.
Yeah.
And then I gave birth to my son, and immediately, after giving birth, like, you're kind of thinking this whole time while you're in labor and while you're pushing, like, I am going to have this child at the end, like, I'm gonna be able to hold my baby, and that was really like the prize that I was kind of visualizing, and they handed me the baby, and immediately took him away again and handed him to my husband, and then the room filled with people, and I was hemorrhaging postpartum, which is it was incredibly painful and even really scary, and the life-saving care that I provided was also it was provided to me was also excruciatingly painful. And then when you lose enough blood, you become hypothermic, and it feels like dying,
Yeah.
And so I had this experience of really feeling like I wasn't going to have that moment, and kind of seeing my baby and my partner kind of fading away from me. And, the end of that story is that I received excellent care from a team of incredible Kenyan health workers, and they saved my life, and my baby was fine, and I've had like this incredible opportunity to live after that. And just really thinking about that fragile moment of motherhood and of infancy.
I'm sorry.
And just like the real like connecting of humanity that experience like provides me, and so I hope that like through my work that I can also kind of like, it's easy to get so technical, and it's easy to get so kind of like into the day-to-day of running an operation, but being able to hold like, actually that's what this whole thing is about. It's like, let's hold our humanity and like ensure that people have that dignity in childbirth and the opportunity to raise their children.
That's amazing. How old are your kids now?
So I have an 8-year-old. That child is 8 years old, and then I have a 4-year-old little girl.
Okay.
Oh, is the first one a boy?
A boy, yeah, a boy and a girl.
Did you get to hold your girl after she was born right away?
You know what's really lovely is that I did. I had with my, I think I was just maybe there's kind of like some karma like coming my way. But my second delivery was just so peaceful. I pushed once. I was able to cut her umbilical cord myself. So I had like this really connected experience that I had, kind of had hoped for. And so that makes really beautiful. Yeah. Thanks.
I have a boy now also.
You do?
Yeah. They're 6 and 10, so
oh my goodness.
A minute too. But it's lovely. And that's why I was like, I was like, because that moment, like, just bringing life into the world, and, things can happen. And think about the women in the rural spaces who don't have that care. Yeah. And then that's just what happens, I think, for them, because they know they're not going to get those interventions, or they're too far from those interventions.
And what's infuriating is that like almost all of those deaths are preventable.
Oh, completely.
We have the technology, we have the knowledge, like it's doable and achievable. And so you just have to line up the political will, the resources, and the operations to make it happen.
And get the boss to help you.
And get in the box. There you go.
There you go. I know yesterday Liev Schreiber said that every NGO should find a celebrity. I was like, okay, let me just go get one in my pocket tomorrow.
Maybe every celebrity needs to go find an NGO.
Exactly. There you go.
Well,
this was incredible. Thank you. I love to hear your story. That's amazing. Thank you.
Thanks for having me. This was fun.
This was so good.
Yeah.
At Global Partners for Development, our mission is to advance community-led initiatives that improve education and public health in East Africa. We envision a world in which every East African community has the capacity to implement dynamic, sustainable solutions to the challenges they face. To learn more, visit gpfd.org.